it's about health care. Well, if it was about health care, they wouldn't be gutting $50 billion out of the rural health care fund.
Hi, my name is Dr. Rubin, and I want to clarify a misconception here. I hope that rural Americans will hear this regarding the One Big Beautiful Bill and the $50 billion provision for rural Americans over the next 5 years. That does not necessarily offset the cuts that the entire bill talks about, which it's estimated between about $60 to $150 billion are going to be cut from Medicaid that goes towards rural Americans. So there is a good chance that many rural hospitals will end up closing because they rely heavily on Medicaid in order to offset a lot of the costs that happen in the emergency room and the hospital settings. And so when these rural hospitals close, then people have to travel further. They'll go into ERs of suburban and urban areas, which will increase the wait times, increase burnout amongst physicians and healthcare workers, and will end up increasing the cost of care for everybody, because then insurers will pass that cost on to privately insured patients, and this is just going to decrease the cost of care for everybody. So everybody should be interested in this. I want to make sure that you share this with as many people as possible so that those that are most directly affected will hear this message.